Good morning. First of all, let me thank the organizers for giving me this opportunity. So unlike the previous studies, what I'm going to present is a retrospective data from China. So this is presented as a poster in the European Lung Cancer Congress in 2022. So the title is Aumolertinib as adjuvant therapy in postoperative EGFR mutated non-small cell lung cancer. And Aumolertinib is a novel, promising oral third-generation EGFR TKI. It has demonstrated efficacy in tumors harboring sensitive EGFR mutations and T790M resistant mutation. It was already approved in China based on a registration phase 2 trial done in patients who had a T790M mutations post-therapy with the first-line TKI. And also there is another trial has shown favorable outcomes with this drug in the setting of first-line setting in patients with EGFR mutation. So, however, the efficacy and safety of Aumolertinib as adjuvant therapy in postoperative patients remain unknown. So, this is just available as an abstract, and full paper is not out. So, there are certain areas which lacks clarity. Anyway, we will go through the abstract. So, methods include patients who underwent radical lung cancer surgery with EGFR sensitizing mutations were enrolled in this study. So, they received the drug at a dose of 110 milligram per daily, and the duration of the treatment varied from 6 months to 36 months. And it depended on the pathological stage and physical conditions. They have not specified further details on this. And they've assessed the disease-free survival, safety, and tolerability. So all these patients underwent chest CT, PET CT, abdominal ultrasound, cranial MRI, and other investigations based on the clinical setting. And so around 66 patients with pathologically confirmed adenocarcinoma with EGFR mutation positivity were included in the study. The stage distribution is also not mentioned. There are patients with stages ranging from 1 to 3. So at the data cutoff, all patients have no symptoms of tumor recurrence. That is, 25 patients have been followed up for over 1 year. And at 12 months, 100% of the patients are alive and disease-free. And none of these patients have central nervous system disease. So this is the outcome information we have. And regarding the toxicity, 34.8% of the patients had adverse treatment-related events of any grade, and there was no grade 3 or more significant adverse events. And the common toxicities were rash, that is in 15 patients, around 22%, mouth ulcer, that is in 7 patients, around 10%, and diarrhea in 5 patients, that's around 7.6 patients. And no patients were withdrawn from therapy because of adverse drug reactions. And another thing that I mentioned, which is not actually very clear, that they mentioned that it is effective in multiple primary lung cancer. There are certain patients who had multiple primary lung cancer, around 5 patients. And they have favorable response to treatment. That is, 2 patients had reduction size of lesions, and the other patients had no change in size. But it's not very clear how this is relevant in an adjuvant setting. Maybe they have some suspicious lesions which are found to be malignant later. I'm not very sure. That information is not available. And so they concluded that this is the first study to demonstrate that Aumolertinib has preliminary efficacy and to a tolerable safety profile in patients with completely resected stage 1 to 3 NSCLC harboring EGFR mutations. And this is still in progress, and further analysis are required to determine the outcome. So this is just a retrospective study. So as we know, Aumolertinib is another Me-too third generation TKI approved in China. And it has already got the approval based on the registrational phase 2 trial that's called as Apollo trial, where it has shown around a PFS of 12 months and response rate around 70% in patients who developed T790M mutation, which is actually comparable to osimertinib. And also in the first line setting, it has shown favorable outcomes compared to Geftinib with the PFS around 19 months. So if you do the cross-trial comparisons, though we do not have any OS data, this can be a promising alternative to osimertinib. But we don't know whether this will change. This will make any change in our practice. Although theoretically having more drugs can lead on to competition and reduction in the cost. If you look at the experience with other molecules, especially the immunotherapy area developed from these countries, have no impact in our practice. So I think this is an area where we should look whether we should have some regulatory changes and policy changes so that we can make use of these drugs, resulting in better access and cost reduction. And in the adjuvant setting also, there are 2 trials ongoing. That is, one is a randomized phase 3 trial comparing with placebo in stage 1 to 3 patients. And there is a separate single-arm trial in stage 1 patients. So that I think that will take some time to come. So this is a retrospective study showing some benefit in the adjuvant setting. Thank you.